In this video from howtogetridofcankersores.com, we're just going to go over how to get rid of a canker sore. Now, canker sores hurt and they're hard to get rid of. And for a free guide on how to get rid of canker sores as fast as possible, as well as how to prevent them, you can visit our site at howtogetridofcankersores.com, and there's a link below this video that you can click on that will take you right there. Now, a canker sore is characterized by a classic lesion of the mucous membrane, and pain can be alleviated by avoiding contact with the affected area. But it's obviously hard to do that if you're chewing on food or eating. And so learning how to get rid of a canker sore is required if you want to free yourself from the recurring pain of canker sores. Canker sores are known as aphthous ulcers, and a canker sore is classified according to how severe the lesion is. A aphthous ulcer may be classified as minor, major, or herpetiform ulcerations. The minor ulcers usually have lesion sizes between 3 to 10 millimeters in diameter. It may appear yellow or gray in color, and it's usually very painful. This type usually lasts about 2 weeks. The second type has the same appearance as a minor ulcer, but the diameter can be beyond 10 millimeters, which causes extreme pain. It takes up to a month to heal, and it'll even leave scars after recuperating. So the herpetiform ulceration happens when a group of small ulcers, usually that average about 2 millimeters in diameter, simultaneously occur as a cluster. After performing a diagnosis of the ulcer, treatments may then be administered to lessen the pain and hasten the healing process. But if the condition isn't very serious, likely in the case of a minor ulceration, home remedies can be applied, and they're usually effective. And if symptoms fade away after about 2 weeks, then the ulceration isn't anything to worry about. But if the symptoms are still there and lesions have grown beyond 10 millimeters in diameter, then you might want to seek professional medical advice and go to a doctor. Major and herpetiform ulcerations may have other serious complications that need to be professionally diagnosed. So, for painful but tolerable mouth ulcers, rinsing the mouth with a solution of a teaspoon of salt and 16 ounces of water can usually help. And this remedy alleviates the pain by just cleansing the wound with the dissolved salt. Also, one thing you can try is a mixture of Maalox and Benadryl in a 2-to-1 ratio that you can swish around the mouth. There are also over-the-counter medications that involve typical or topical application of certain ointments like benzocaine, and these can relieve the discomfort by giving you a numbing effect. These type of ointments also have special ingredients that will help the healing process. Medical professionals can obviously help patients decide on the appropriate brand of ointment to be used, but if these are the minor ulcers, it might not require a doctor visit. Medical doctors, if they feel like they should treat it, they can apply what's called silver nitrate directly onto the affected canker sore area, and this is known to heal the aphthous ulcers within 3 to 5 days. And pain is also relieved very quickly with this method. But it's important to understand that there's not any proven cure to entirely avoid canker sores, so learning how to treat them at home or to just help alleviate the pain is really the most you can do. For a free guide on how to get rid of canker sores as fast as possible and how to prevent them, you can visit our site at howtogetridofcankersores.com.